Communication with adolescents. A cancer diagnosis during the adolescent years coincides with critical transformations in growth and development. Diagnosis can disrupt the normal developmental trajectory, impact on growing independence, impede the establishment of new social roles, disrupt evolving body image and self-esteem, affect mental health, disrupt successful transition from education to employment. A common challenge when caring for adolescents is balancing the competing wishes of parents to that of the adolescent, particularly about how much information they are provided. Adolescents want open disclosure of information and greater involvement in decision-making than they receive, but sometimes find it difficult to understand medical information. Certain topics may be particularly difficult for adolescents to raise, yet can be very important to talk about, such as fertility. Distress is often underacknowledged and the cause of distress poorly understood by clinicians. The willingness of an adolescent to speak with a clinician is strongly linked to their familiarity and comfort with that clinician. Treatment adherence is particularly poor in adolescents, requiring a strong therapeutic alliance and clear, upfront communication. These are some of the recommendations for communicating with adolescents. Establish rapport by actively listening, demonstrating genuine concern, being honest and trustworthy, displaying professional expertise, providing reassurance, support and empathy, and displaying humor. It is important to clarify roles and expectations of a relationship. Explicit discussion about certain topics, for example, roles, experience, how the health system works, confidentiality, and its limits, and clarifying the younger person's expectations can reduce anxiety and uncertainty and promote a sense of trust and safety. Be empathetic, respectful, and non-judgmental. This is particularly important when discussing issues such as non-adherence to treatment, missed appointments, sexual practices, or risky behaviors such as substance misuse. Provide information that is relevant to the younger person's life stage and level of cognitive and emotional development. Young people may not be able to understand or remember adult explanations, so find alternative approaches to communicate with them about their cancer and treatment. Allow time for discussion, information processing, and repeated questions. Young people may require frequent repetition of information to assist understanding. Adjust language and explanations accordingly. Provide complex information in a number of different ways, for example, written information and diagrams. Avoid medical terminology and jargon. Invite adolescents to participate in medical decision-making. The majority want to be involved. Involve adolescents in discussions with their family about advanced care planning when relevant. Respect, reassure, and maintain the confidentiality and privacy of the young person at all times. Confidentiality is best addressed in a transparent manner with both the young person and their family in the initial consultation, and regular intervals through the journey of the patient. Allow for time alone with the young person. At some stage during their consultations, parents, partners, or other support people are asked to leave the room so that the clinician can consult with the young person alone. Prompt common questions. Young people may feel intimidated in healthcare settings and may be reluctant to ask questions directly. Silence should not be interpreted as a lack of desire to understand what is going on, or an indication that they do not have any further questions. Provide young people with reliable internet and website information that is safe, authoritative, and appropriate to their age. Be aware of cross-cultural differences in the family's preferences for managing illness. In addition to tailoring communication to the child or adolescent, Communication should take into account the parent's support and communication needs, and those of siblings and extended family as well. Coordination of care and communication amongst the clinical team members is critical. In being mindful of these strategies to involve and communicate effectively with adolescents, better rapport can be built when communicating difficult news.